Very good afternoon to everybody here in this hall. At the outset, I'd like to thank the organizers for giving me this opportunity to speak something about the curriculum in HPB surgery. My talk will comprise of key components of a course in general. What are the types of curriculum? How do we design a curriculum, step-by-step approach? Teaching and learning strategies, formal and experimental training, EPAs, assessment and summary. Now it comes to key components of the course. As everybody knows, you have to have a theoretical component, clinical and practical skills, teaching skills, research, and attitudes and communication. So these are the 5 important areas training has to be strengthened when we form and have a new course. So what are the types of curriculum? When it comes to the core curriculum with electives, most of the courses will have 80% of hardcore curriculum. Now what we mean by hardcore curriculum, a person who has to successfully do the course must attend and pass 80% of this hardcore curriculum. Soft core is the outer core, must attend and may pass. And lastly, electives may attend and may pass. However, now there is a shift. The shift is to an integrated curriculum, the SPICES model by Harden, proposed in 1984, and still this is one of the important components which is used for the curriculum formation. So earlier curriculum was teacher-centered, information-oriented, subject-based, and now the present focus on the curriculum is student-centered, problem-based, integrated, communicative-based, elective-driven and systematic. So what is the competency-based medical education approach? Now this is the current curriculum which is most commonly used. It is outcome-based oriented training. Now when we say what is outcome-based, focuses on achieving defined competencies such as proficiency, let's say in some HPB procedures, and other something like principles of liver transplantation. Now once a person has completed this, the outcome should be such that the person has achieved these competencies in these areas. And how do we assess? Assessment is, of course, most of the time always summative, but a workplace-based assessment and EPA assessment is now the norm when it comes to the curriculum using real-world scenarios. And of course, it is a flexible learner-centered progression, allowing trainees to advance based on competency acquisition. It's not a fixed time frame. If somebody is very good, they can achieve the curriculum, they can achieve that competency, a part of the curriculum earlier. So this is curriculum development process, David Kern's 6-step approach. Problem identification, if you want to start a new course. Need assessment, goals and objectives, educational strategies, implementation, assessment and evaluation. So when we design a curriculum, you have to have a step-by-step approach. Why the course is needed, justification for that, develop the vision and mission for that course, framing competencies and then SLOs, specific learning objectives, define the structure. Once you have defined the competencies, you have to have the TL methods, teaching learning methods and assessment methods for those competencies. Then implement the curriculum and then refine it. And then you have a evaluation strategy and then review and review-based feedback to completely revise the curriculum if need be. So when it comes to HPB curriculum, why this course is needed? Now we are having such a big conference here that itself justifies that this has come up quite a lot, this branch. Why this course is important? Rising burden of HPB malignancies and other complex benign disorders. Increasing need for minimally invasive and robotic HPB surgeries, which is a part of the curriculum. Demand for specialized HPB surgeons in different centers. And lack of structured MCH HPB programs. So what should be the vision and mission for a HPB training course? Of course, so vision has to be to train the HPB surgeons, form a good pool of those, and provide structured theoretical and practical training, technical skills, clinical decision making, leadership skills, research and academic contributions. So, how do we do this? What do you mean by framing competencies? So, you have to actually take the course, define the areas, have those competencies defined and then break down into specific learning objectives. Now, just to give you an example, you can see here these are the NMC guidelines. Competency should be there for these particular disorders. They have written this particular organs, imaging, oncology, trauma, transplantation. They have also mentioned that competencies should be there for clinical examination, then surgical procedures, endoscopic procedures, physiological studies, etc. And of course, the affective domain, that is the teamwork, ethics, etiquette. So, it will be having this particular guideline state that a person should be expert, should become an expert after the course is completed in the cognitive domain, psychomotor domain and affective domain. So, why we should develop specific learning objectives? To provide clear expectations for trainees and allow for structured assessments. Now, when we talk of SLOs must be smart, specific, measurable, achievable, relevant and time bound. Now, this is what are the SLOs for at the end of the HPB course, MCH HPB course, a person should be able to do: diagnose, investigate, manage and follow up on HPB diseases, interpret clinical and lab data, understand indications, contraindications of different procedures, stay updated, gain exposure to all HPB subspecialties, be familiar with allied and general clinical disciplines, impart basic HPB surgical training, and then of course identify, plan, conduct and communicate HPB research apart from ethical issues. Now, if you just see the example, let us take the example of liver transplantation. So, the overall goal, if a person is in HPB course, I am not saying they get fully trained for it, but just an example, to develop expertise in the evaluation, surgical techniques and post-operative management of liver transplant. So, this is the overall goal. Competency will be demonstrate the ability to assess liver transplant candidates, perform liver transplantation and manage post-operative transplant complications. So, the whole unit is covered with this competency. Now, once you want the person to achieve this competency, the following SLOs have to be done. They have to be achieved. The knowledge about indications, contraindications of liver transplant, etc. has to be achieved. The skill for performing the different procedures, organ procurement, everything else. Attitude, multidisciplinary MDT approach, and then application, interpret post-op complications including rejection, etc. So, once you have these SLOs, you have to have the TL methods, teaching, learning and the assessment methods for that. We will see that a little bit later. Now, overall the curriculum has to be divided into macro and micro levels. Macro levels, first year core concepts, second year advanced HPB procedures, third year complex cases, leadership laws and exit examinations. So, how do we align this teaching, learning methods and assessment methods? Now, these are the things what we said, example of liver transplant. Now, for each of these SLOs, this is how you have the knowledge. The teaching, learning will be didactic lectures, case based discussion, journal clubs, etc. Evaluation will be done with the help of MCQs, structured viva, case based oral discussion. Then skill, hands on training, simulation, operation theatre, assisting and then observing them, assessment methods by DOPS, OSCE or MiniCEX. Attitude, application, similarly you will have different ways of teaching, learning methods and then assessment methods. Lastly, once you have the curriculum ready, it has to be implemented. The faculty has to be aligned, it has to be seamlessly integrated into the clinical practice and then you have to continuously monitor. A new curriculum has to be monitored very well because there will be some deficiencies, some lapses which have to be refined by iterative improvements, stakeholder involvement, accreditation and quality standards and periodic curriculum review. If you carry out all these things over a period of time, the curriculum will become refined and good. Once it has been defined, refined and has been implemented successfully, The next step will be the evaluation strategy. That does not mean a curriculum is a dynamic process. So you have to see whether it is established, the clear goals are established, learner competency, what you wanted, the students are learning that, the faculty is finding it convenient, they are able to have an effective domain in that, and the overall program impact on the and collect stakeholders feedback. After that, if you want regularly review evaluation data, you can start modifying and again improving the curriculum. So, revise the curriculum, document changes, maintain records, update policies and communicate the revisions to the faculty and trainees. So, once that is done, the curriculum is properly and firmly put in place and then it can be utilized. So, this is a document MCH HPB NMC document. You can see there formal training, then you have experiential training. All these the first one is basically about the knowledge part of it, the second part is the skills part of it and the psychomotor domains, affective domains, all these things are covered. So, this is the posting what they mentioned 6 months basic posting and next 30 months is the posting. So, this also includes research and academic training and what they have mentioned is thesis requirement is mandatory and then the students should be exposed to clinical and translational research and should be encouraged to participate in national and international HPB conferences. A little bit of word about EPS. EPS means you have a specific area, short procedure and then entrustable professional activity, they should be able to master that. Let us say phrase procedure, step by step you break into different parts and let the student master it. Similarly, you can have preoperative patient evaluation, person performing major HPB procedures, all these things can be broken up into smaller units and then make sure that there is a progression through supervised independence and then the students can perform them independently. So, this is an example of an EPA. For liver transplant candidate, you can see the teaching learning methods, supervised patient assessment in transplant of OPD etc. The assessment methods, Minic X, DOPS, competency based OSCE, all these things will make the student well trained into that particular procedure. So, these are the methods of assessment formative and then you have workplace based assessment and summative assessment. These are the theory and practical, this is how usually the course runs. And of course, lastly the faculty development and capacity building. This is necessary because regular faculty training workshops are necessary, TTT modules, train the trainer modules and this will encourage the faculty for research and mentorship. So, in summary, curriculum design is a dynamic process. The CBME, that is the competency based approach, ensures competency based training and continuous feedback and innovation are key because it is dynamic and continuously you have to refine the curriculum. So, this is something how we start a course at JIPMER, different approvals are required. Thank you very much for your kind attention.